Okay, I do see 6 of our media in attendance. Welcome, everybody. And at this time, I'd like to welcome our members of the media and those viewing the live stream today to today's press conference with representatives from the Blue Ridge Health District. We are scheduled to begin at 12:30, which is now. My name is Joe Rice. I'm with the City Communications Office, and we are hosting this Zoom webinar, and I'll be moderating today's Q&A with our credentialed media in attendance. Just a few notes before I hand it over to Catherine Goodman, the Blue Ridge Health District's Public Relations and Communications Manager. After the presentation, we'll give each media member 2 opportunities to ask questions, and both opportunities will include your initial question and 1 follow-up question. We'll make sure everyone gets a chance to ask their first question and follow-up before we move on to the second round of questioning. As always, please keep your questions respectful and thoughtful for all of our participants. We appreciate your participation. And with that, I'll hand it over to Catherine Goodman.
Hi, everybody. Thank you for joining us today. I'm Catherine Goodman, the Communications and Public Relations Manager for the Blue Ridge Health District. I'm here with a few other colleagues and panelists. So we have Dr. Denise Bonds, who is our Medical Director for the Health District, Ryan McKay, who is the Director of Emergency Preparedness and Planning, and also our COVID-19 Incident Commander, and Rebecca Schmidt, who is the Director of Partnerships and Strategic Initiatives for the Health District. We are going to provide you with a lot of different updates today, and we will also be sending out a newsletter later this afternoon to recap all of the information that we're sharing. And we are looking forward to providing you with a lot of information and updates about our vaccine efforts. So we'll go to the next slide, and Dr. Bonds will start us off.
Sure. So thank you all. If we could have the second slide, please. There we go. So today we're going to talk about vaccine distribution and allocation to let you know where we are with that. We're also going to let you know about our new COVID-19 vaccine center. We are going back to VAMS, and we'll talk about why that's the case. What our vaccine plans are. We'll be opening to manufacturing and farm and agriculture. And we have started vaccinating 16 to 64 high risk, and then we'll give you an update on our next steps beyond those groups. Rebecca Schmidt will be giving an update on the Equity Task Force and their plans going forward. And then, of course, a reminder to have everybody pre-register so that we can invite you in for your vaccine. If I could have the next slide, please. So here you see the vaccine allocation for the upcoming week of March 22nd, 2021. There will be just under 12,000 vaccines available in our health district. These are vaccines that are coming through the state, so it does not include any independent pharmacies that are working through the federal stockpile plan. Of the 11,650, 5,800 will be first doses. And then we have an additional 2,000 doses of J&J vaccine that we will be utilizing next week as well. We are continuing to finish up with phase 1A, the healthcare personnel. There's a few individuals that we still haven't reached yet. And then, of course, there are new individuals that have just taken jobs within that area, and we will continue to prioritize those individuals. We are still working through our 1B essential workers. And as I said, we're moving into manufacturing and farm and agriculture. We are vaccinating individuals who are 65 and older, and those who are 16 to 64 with high-risk medical conditions. Upcoming will be new allocations, and you'll begin to see that in the next week or so to primary cares and to pharmacies. And we expect to see additional vaccine probably hitting us around the first week of April or so. So we anticipate a similar allocation for next week. So for the following week, March 29th, but then the week after that, we should see an additional increase. Can I have the next slide, please? So just to give you an indication of where we're at with our vaccination efforts, we've done 98,000 individuals, or 98,000 vaccines, sorry, not individuals, have been administered in our health district. This includes both vaccines that were done by our hospital systems, done by the federal stockpile, and done by the health district. Remember, most individuals have had require 2 vaccines. So this is not really the number of who are fully immunized at this point in time, but the number who have some immunity at this point in time. Importantly, we've been able to get through 74% of the individuals who are 65 plus and that were pre-registered on the system. So 74% of the 65 plus pre-registrants have received at least one of their vaccine. So we're really pleased that we've been able to provide so many vaccines to this group. And we've done 16% of the 16 to 64 high-risk pre-registrants, and they have received at least one of their vaccines. So I think it's really important to remind everybody that we need everybody to go to the state registration system and pre-register at this time. If we could have the next slide. And I'll turn it over to Ryan McKay to talk about our new vaccine center.
Thank you, Dr. Bonds. As everyone knows, we have been primarily in Charlottesville operating out of the Kmart location and the modular structure that was put up in partnership with Red Light Management, Bama Works, and Skyline Tent. We've recognized the need to expand and grow as we anticipate a larger allocation of vaccine in the coming weeks and months. And while that tent has been serving a tremendous purpose and service to the community, it does present some challenges for us as we operate. When we have larger volumes of people, it puts people outside as opposed to inside. It sort of limits the amount of vaccinators we can have and the number of chairs that we can provide for observation areas. And so working with Mr. Richard Hewitt, who's the property owner, Albemarle County, and the Emergency Communications Center, we will be operating out of the Jcpenney location beginning on March 23rd. It provides us with about 100,000 square feet to space out, to operate, to bring people inside from the elements if they are occurring, and gives us much more room in terms of distancing, providing ample space for the vaccinators, and then increasing our ability to run larger numbers of individuals on any given day. So provided that the vaccine allocation increases, we could run up to 2,000 people or administer 2,000 doses per day out of that location. We will operate initially 4 days a week for right now, and that's just based on the number of vaccines we're receiving in our weekly allotment. As that increases, we'll increase our hours of operation, but also our days of operation. This is still by appointment only. I'll talk a little bit more about our switch back to VAMS in a minute. And at the Jcpenney location, we'll be focusing on wrapping up 1As, 1B essential workers, and then 16 to 64 who are high risk with underlying health conditions. Do want to thank Red Light, Bama Works, and Skyline for working so quickly and coordinating to get that modular structure up and running. And then again, thanks to Mr. Hewitt, Albemarle County, and Emergency Communications Center for really moving just as quickly to provide access to the space. There are still ongoing operations throughout the community. So while we have this large space with high volume coming up from the Jcpenney location, the University of Virginia Health System will continue to manage the site at Seminole Square, really focusing on finishing up the 65 plus and special populations through that location, and then helping us with our community sites operating in partnership with community members to really be much more mobile and going to where people live, serving different organizations, advocating for different groups who may not always have great access to the vaccine, and really working to provide widespread access throughout our localities. We are also operating in large partnership with individuals across our localities to focus on sites in Louisa, Fluvanna, Greene, and Nelson. We are there at least once weekly at fixed locations, and also doing some mobile operations to get to individuals who don't have great access to those fixed locations. Next slide, please. So VAMS is back. We were using this vaccine administration management system at the initial onset of the vaccination campaign. We did run into some issues with this, primarily that once people gained access to the system, it was difficult for us to control who had access to appointments based on their phase. what has happened over the last several weeks are a couple things that have forced us to move back to VAMS. One, a lot of the bugs and the issues that we were facing with VAMS initially have since been corrected and updated. The software itself has been updated. Our staff have been retrained on those updates. It gives us more control over who access appointments. It allows us to create sort of closed pods within the system so that we can focus on individuals who are currently eligible before other individuals gain access. It allows us to have some flexibility with how we set up appointments for our localities as well. So it helps so that we can make sure that people in our district are getting access, to make sure that individuals who are currently eligible based on the phase that we're in get access. And it also gives us some more flexibility on the back end to create opportunities for people to access appointments over time. A number of issues arose with PrepMod. These are both highlighted in incidents or issues that occurred at the local level, at the Kmart location in particular, where if a link was provided for PrepMod to schedule appointments, that link could be shared widely, and there was no control over who gained access to those appointments. So individuals who aren't in any phase and would receive the vaccine much later could actually access appointments. And this created huge concerns for us. It meant that individuals who really needed the vaccine first and foremost may not be able to get those appointments. And then on the back end, it meant that our staff had to do much more, make much more effort and time in controlling who did get access. So when a link was sent out, what would occur is that our staff would have to go in and remove individuals who are not currently eligible, and they had to do that on a daily basis. We also had to use Eventbrite to try to control the access to the vaccine. And it just became something that was unsustainable for us in the long term. In general, this is going to make it much easier for individuals who currently need access and are eligible to get appointments. And it helps us on the back end manage control much more easily and efficiently moving forward. So how does this work? We will take line lists that we pull from the VDH database, cross-reference those, for example, with employers line lists, and then upload that information into VAMS. Individuals will then be able to finish up setting up an account, and then from there can make appointments based on the clinics that we set up within the system. It's much more smoother, much more efficient, and then we will communicate information about when those opportunities come up. VAMS appointments will go out via email starting tomorrow for the Jcpenney location and localities, and that will be for next week. So starting on the 23rd, appointments will be identified through the VAMS system. And then one thing before I turn this over to Rebecca Schmidt to note, one of the issues, back to moving over to Jcpenney, one of the issues that we faced is weather related. And tomorrow there is a call for severe weather, rain, thunderstorms, a slight chance of high winds and high damage. And the space limitations and the concerns about weather, we are going to move all appointments scheduled for tomorrow, Thursday the 18th, to Friday. And our hotline is currently reaching out to individuals via phone. We're working also via email to communicate those changes. But it just highlights, again, the need for us to find a more fixed location, more hardened infrastructure that allows us to operate during the spring months when days like tomorrow are always on the horizon. And with that, I will turn it over to Rebecca Schmidt.
Hi, good afternoon, everyone. If I could have the next slide. So several weeks ago, we convened an equity policy group that I mentioned in our last press conference. And that includes membership from UVA Health, from Sentara Martha Jefferson, from the city, the county, and the health district. And those are the organizations that are part of our unified command and vaccine response. This group reviewed national frameworks and local policies. We know across the country and really across the world, governments and local health departments and partners are looking at ways and frameworks that we can use to more equitably distribute our vaccine. We know that first come, first serve is not the only strategy we can use if we're going to reach all the people in our district that need vaccine. So today we're releasing a policy statement with a clear commitment around communication, allocation, and distribution that is currently on our website and will be shared with all of you and through our newsletter today. It's a 2.5-page document that kind of outlines our commitment and what we're advising any providers who receive vaccine to do. And that is really to focus in particular on our communities that are at highest risk of hospitalization and death. And in our district, that's our Black community and our Latino community. And you can see that if you look at the graph that is readily available on our website on a daily basis. That includes updates as we see COVID cases and hospitalizations in our and deaths in our district. We're also working with community partners and leaders in each of our localities to set up additional sites. As Ryan mentioned, those include through senior housing, but also our community sites and churches and community centers. And again, we really want to emphasize a no wrong door approach, that you can get access to the vaccine if you're eligible, if you're at higher risk of developing any comorbidities or anything related to COVID-19. I do want to emphasize that this policy is dependent on what comes down from the state level. There is a state policy group that has been set up and is working to advise the governor. And obviously, as we are part of the Virginia Department of Health, what we do locally is somewhat dependent on what is driven at the state level. So we look forward to receiving that policy from the state, but wanted to move ahead locally with our local commitments and the commitments of our partners, again, in making sure that our vaccine allocation and distribution is more equitable. Along with that, we are also hiring additional positions, including additional data analysts, to help us with providing more up-to-date data. And we're really hopeful that the IT systems that Ryan has mentioned, both the state level pre-registration system and our switch back to VAMS, will really assist us in getting better numbers more widely available for our community, because we know that a big part of equity is transparency and communication. And because of the IT systems we've been given to use, that has been very challenging. So I will move to the next slide for Catherine, I believe, to close it out.
Thank you. Okay, Dr. Bonds has mentioned this a few times, but we wanted to remind everybody to pre-register in the state database so that we have your information so we can call or email you when it's time to schedule an appointment. On here, the website is vaccinate.virginia.gov. There's now an option to check your status and to update your record. And it's really important that individuals go in to make sure that they are in the system with the latest, most accurate information. The information being accurate is what we need to be able to reach you to schedule your appointment. We also want everybody in the district to register now. So whether you fall into phase 1A or 1B or even 1C, we want everyone to be pre-registered because we anticipate an increase in our vaccine supply in the coming weeks and want to be prepared for when we're ready to move into phase 1C to reach out to more individuals. Along these lines, we also ask that employers assist all of their frontline workers with registering in the system. If you have employees who potentially before we worked with you as an employer to collect your line list, we are now going to be pulling individual employees by occupation from the state database. So we want everybody to be registered. And we can go to the next slide, please. And then just a friendly reminder, as we can't say it enough, it's still important that everybody follows the proper mitigation strategies. We still do have COVID-19 cases spreading throughout the community. And as people are starting to be vaccinated, it's great. And we hope that we will experience a decrease in these cases, which we've seen slightly lately, but it's important that we're still cautious as not everybody is fully vaccinated yet. We need everybody to follow these mitigation strategies until at least 75% of the population is fully vaccinated. So this includes wearing face masks, maintaining your physical distance, washing your hands often, And of course, limiting your time with others. And the CDC did recently release guidance for how fully vaccinated individuals can participate in social gatherings with other fully vaccinated individuals. So that's a specific scenario, but we're asking that everybody continues to be cautious as we continue to see some cases in the community, but are hopeful that this will start to decrease even more as more individuals are being vaccinated. And the next slide. So that was a lot of information that we provided for everybody today. Like I mentioned earlier, we will be sending out a newsletter blast this afternoon to all of our community members and community partners to provide all of this information in writing. Please be on the lookout for information or scheduling appointments through the VAMS system, so the Vaccine Administration Management System. It will come through a CDC email address so that it's a certified email, and we will make sure that everybody has that information in the newsletter as well. And then just a reminder that our hotline is available 8 a.m. to 4:30 p.m. Monday through Friday. The hotline is staffed locally with both English and Spanish speakers, and we have resources for both vaccination clinics locally and also testing resources, contact tracing and investigations, and more. So give us a call if you need anything, or visit these two websites listed as well to pre-register in the system and find out more about the COVID-19 vaccines. Thank you. And we will open to question and answer with our media partners.
Great. Thank you, Catherine, and thank you, everybody. And as Catherine mentioned, yes, we are ready to take questions. And 1 second. And if you do have a question, we'd like you to please raise your hand, and you'll be called upon in the order of hands raised. After I call on you, you can ask your first question and one follow-up question. And we'll give each media representative 2 opportunities to ask questions in this format. And our first question comes from Rachel Hersheimer with NBC 29. And Rachel, you are, I'm sorry, 1 second. Now you're on with BRHD. Go ahead and ask your question.
Can everyone hear me? Thanks so much for doing this. So my first question is, some health districts are transitioning to phase 1C of vaccinations this week. VDH said all communities in Virginia should be able to open to this group of essential workers within the week. So my question is, when will we be opening vaccinations to phase 1C? And if we're not doing it this week or next week, then why?
Yeah, so I'm happy to address this question. I think it's really important to remember that every health district has a different population base. So because we have 2 major medical centers, that resulted in our area having a considerable number of individuals who met the qualifications for phase 1A, and we're still trying to finish off individuals in that group. Additionally, we have a very large number of individuals that are over the age of 65 and 75 because many individuals retired to this community. And so that's meant that we've had to spend a lot of resources on those groups as well. And that's a really vulnerable group at high risk of having an adverse outcome from COVID. I think that what you'll see over the next week is that we'll try and quickly offer the remaining groups in phase 1B an opportunity, and hopefully be able to send out a blanket invitation to individuals in 1C fairly shortly after that. Our goal, like the governor's goal, is to be open to everybody by mid-April. And that's a really ambitious goal, I think, and certainly dependent on the amount of vaccine. But we do have more vaccine that's showing up every day. We will have more Johnson & Johnson available to us. That's a little more efficient because it's a 1 shot. And we see a lot of people want that vaccine because it is a 1 shot as opposed to a 2 series. So I think we'll move into that area pretty quickly, but I think it's important to remember that in our geographic area, we're very heavily weighted towards 1A and 1B with our population.
And just to clarify, I know you said that you're moving back to VAM. So are you using Eventbrite and PrepMod at all, or you're not?
We are not using Eventbrite after this week, and we are not using PrepMod after this week. We will be strictly using VAMs moving forward.
Okay, our next question comes from Jesse Higgins with Charlottesville Tomorrow. Jesse, you are on with the Blue Ridge Health District.
Hi guys, can you hear me? So my question is actually about kind of a small group of folks that I've heard are having some difficulty getting their second doses of either the Pfizer or the Moderna vaccine for various reasons. Either they're struggling to get it with CVS, or maybe they were working in an area that was vaccinated by their workplace and are no longer working there. So are you seeing many of those cases coming to you? And if so, what are you like, how are you navigating that?
Yeah, the CVS for a short period of time was taking people on a wait list if they had extra vaccine. Remember, many of our vials of both Pfizer and Moderna allow us to get what is considered an extra dose out of that vial. And so we schedule for what we believe will come out of that vial. And sometimes when we get an extra dose, that allows us to vaccinate an extra individual. And that was what was happening with CVS. But in the CVS registration system, when you register for your first dose, you also register and make an appointment for your second dose. And so those people on the wait list never had the opportunity to make their second dose appointments. And we are trying to accommodate them in the tent or at one of our locality events. So if someone is in that situation, if they call our hotline, we will work to get them into their second dose. Similarly, there are a number of individuals, particularly who either were residents or in a long-term care facility for a very short period of time, who might have gotten their first dose through the long-term care facility pharmacy program, but didn't get their second dose, or have been discharged from that facility and need their second dose. If they're still in the facility, the state is setting up a pharmacy long-term care facility partnership. And for the most part, those are being taken care of in that fashion. There are a few individuals that we're working to get through either our vaccination site or Seminole Square. If they've been discharged or if they no longer work at that facility, again, if they call the hotline and explain their situation, we can work to make sure that they get their second dose.
Okay, thank you. That was actually, I don't have a follow-up to that particular question.
Thank you, Jesse. Our next question comes from Tyler Hamill with the Daily Progress. Tyler, you're on with the Blue Ridge Health District.
Hi, everyone. You able to hear me okay?
We can.
All right, perfect. So some of the other health districts, such as the Richmond one, have opened up larger sites in order to, I guess, facilitate larger mass vaccinations. Are there plans to do sites larger than the Jcpenney location in the future, or is that about the capacity y'all are looking at right now?
The Jcpenney location allows us to have up to 30 vaccinators. So that's a pretty high volume location. And with 100,000 square feet, there's obviously room to expand. So we don't anticipate opening up anything bigger, just given the volume of vaccine that we're going to receive. Having Jcpenney and the Big Lots location that UVA is managing, those two large sites are going to be enough for us in the health district. And then we'll focus any other efforts on additional sites and localities or working in neighborhoods and in smaller parts of the community to provide access there.
Gotcha. And for the individuals who received their first shot at the Kmart location and have registered for a second shot at that same location, will they be receiving notifications about the change?
Yes, they will be receiving notifications to go to the Jcpenney location and not to the Kmart location.
Thank you, Tyler. We'll be moving on to our second round of questioning, except we do have a few others that did not participate in the first round. If you'd like to raise your hand and participate in the first round, please do. And Sean Tubbs, you are now on with the Blue Ridge Health District.
Thank you. Just real quick, I just want to make sure. So pre-registration is open to everybody at this point. And I think I heard you say that you do encourage us all to register, to pre-register.
Yes, great question. And I'm happy to clarify. We want everybody to pre-register right now. It doesn't matter what phase you're in or when you will qualify. We want everyone registered in the state system.
Thanks. Just want to make sure. And I just did, by the way. So
Good. That's great. Thank you.
And just so everyone's aware as well, we did partner with a large group of community volunteers and organizers. They've set up a phone bank and they're calling down to start with voter registration lists in each locality for 65 and older. We're also working closely with Madison House from UVA to start calling businesses to make sure employees are pre-registered. And then just really want to thank all of the pastors and churches and community groups who are out there helping congregants and others get pre-registered in this system.
Thanks, Rebecca. And we'll now move on to our second line of questioning. If you have a question, please raise your hand and I'll call on you in the order of hands raised. And once more, we have Jesse Higgins. Jesse, you're on with the Blue Ridge Health District.
Hello again. So I don't know if you'll be able to answer this off a hand, but perhaps you can point me in the direction to get this answer. You mentioned that this region is heavily populated with 1A healthcare workers and retired folks that are 65 plus. I'm wondering if there is a general breakdown that you have of the percentage, if not numbers, of people in those different phases here.
Jesse, we can. Oh, okay.
Well, I was going to say, we can certainly point you to the demographics for the area. And Catherine, maybe you can put out in the newsletter a link or point out where the Map to Health report is that has all of the breakdown by demographics by area. In regards to healthcare providers, that's a really great question. I don't know that I know of all of the individuals working in this area, how many are healthcare. We certainly, UVA employs a lot of people and they were all eligible, or at least all of their healthcare workers were, so.
And also, Jesse, to kind of help with some of this, at least with the 65 plus group. So Dr. Bond shared earlier that roughly 74% of pre-registrants in the 65 plus group have been vaccinated. There's about 11,000 left, 11,000 pre-registrants. It could be people who are in the system registered twice, but it's about 11,000 folks that we have left for the 65 plus list.
The state website also contains a demographic page of people who have been vaccinated. And so you can go online and look, and it gives it both as a raw number and as a rate. And so you could compare it to other areas in the state to look. That would at least give you the age.
And I'll finally, also highlight the UVA Equities Center, who we've been working with, and they have several analyses on their website, including around frontline workers. And we're working with them to drill down even further into that data, but there's some really important analyses that they've done that are already available. So we'll be sure to include that link as well.
Oh my gosh, thank you guys. That was more than my question, so that's appreciated. I'm wondering if I can, for a follow-up question, actually follow up on my previous question. Is that allowed?
Sure, go for it.
Okay, thank you. So my previous question was about people that are struggling to get their second doses. Like, just how common is this? Is this something you're seeing a lot, a little, or?
I think it's somewhat common that we're experiencing this. What we're hearing is from folks who chose to go to CVS or a pharmacy a couple hours away that are asking to come here for their second dose. And our recommendation is that if you schedule a first and second dose appointment somewhere, that's where you should go for your first and second dose. There are outstanding situations like Dr. Bond shared earlier where we will help cover people who need to get a second dose here.
Thank you, Jesse. And if anybody else has a question, please click the raise hand icon. Catherine, I see no other hands raised.
All right, well, thank you all for participating today. Thank you to our panelists from the health department and to all of our many community partners who have helped us with vaccinating over the last few months. we have been in this pandemic for a year. March 15th, just a few days ago, marks when we had our first positive case identified in the health district. And it has been a long year, I think, for all of us, whether you're working in public health, COVID response, or you've been home for a year and doing your part in helping to prevent the spread of COVID-19. So thank you to everybody in the community as well, and for your patience with the vaccine rollout. As I've mentioned, we will send out information in a newsletter this afternoon and continue to provide information weekly and host another press conference in a few weeks. Thank you all.